Hey guys, it's Anthony back with training day number 7 from my recovery of Lyme disease and heart surgery. Today we're going to go further into core stimulation for some more activation there. We're going to do some more brain-based activation techniques. First, we're going to start with the same ones that we've done before, taking the towel and stimulating the sensory component of the motor nerves for the abdominal musculature. So this is going to fire up those nerves, so it's going to fire up that abdominal musculature. It's a really nice way to get those muscles facilitated when a lot of times they're inhibited in people. Okay, that's good. And the next we're going to use the vestibulocholic reflex. Putting the hand on the head and press. And relax. Make sure you're pushing your head into your hand. And begin. So you should be feeling your core activating when you do this move. All these exercises, all these techniques are going to stack on top of each other and help facilitate all those core muscles. There we go. Okay, the next one we're doing is the near far drill. So we're going to look at a target nice and close, and then you're going to look far away. About 1 second per target. Again, about 10 to 20 reps there. Next one we're going into doing mandible mobilizations. So first one, protrude it out and back. Now those can work to facilitate the core because of fascial continuation from the abdominal musculature to the jaw. And the next one for the jaw is side to side. An additional one we can do is called circumduction, so trying a circle type motion. And reverse it. Next we have sagittal suture stimulation. So the sagittal suture is right at the top of the head. You can put your fingers right on there and just rub it back and forth. For me, I can feel this one quite a bit. In the core muscles, it really lights them up. Again, that can be a factor that comes into the fascial continuations. Stimulating that will fire up that whole fascial pattern. And you can do that for about 10 to 15 seconds. Another core exercise you can do from a mobilization standpoint, including those fascial continuations, is the maxilla. So the mandibles is the jaw, and the maxilla is the upper portion of the jaw. So you can lean back, open up the mouth, take your thumb, put it on the roof of your mouth, and when you breathe in, you push up, and then breathe out and release. Now this is just a light mobilization, so don't go too hard with it. You can add in some pressure on your nose as well to help with the mobilization. We're continuing with the core activation. We're going to go into that fascial stimulation. Tuck the pelvis backwards, right on that line where the rectus abdominis and the obliques come together. So just fall off from the front, and you're going to dig your fingers in right there. Shaking is okay. And then come up out of it. You don't want to lay back because then you're stretching out those muscles that you just facilitated, which can inhibit them. Back into it. Really dig in. Back up. Little rest, and then we'll go right back to it. One more round. Here we go. And back out. Then from there, we're going to go right into that tuck hold where you're holding up your knees like this. So want to lift the bottom up to really tip that pelvis down backwards and pull the chest down. Arms can be up or down. And begin. Back up. Again, keep that nice core position. Don't lay all the way back. We'll go back into it. Keep those knees together. Those feet all the way down. Short, shallow breaths. Back up. Again, just like that, rocking out of it, holding that position. And we'll go right back into it. Keep holding, nice and strong. Hold it as long as you can maintain good form. And back out. We're back in the kitchen for the holds with the chairs. Again, lifting up right here as high as we can and tucking the knees up towards the chest. Legs, push together. Here we go. Try to maintain as stable as you can when holding this position. Little rest break, and then we'll do it again. Here we go. As you can see, I was starting to lose it there a little bit, get a little fatigued. We did longer with the core exercises, but we're still building, we're still gaining. A little bit longer break, and then we'll get right back to it with the last one. Remember to do it as long as you can maintain good form. You don't need to do it any longer than that. And here we go. We're going to start with the bike now. We're going to do a steady state exercise, maintaining in the blue zone for the heart rate monitor. And we're going to try and maintain that for about 30 minutes this time. I'm going to move up to 30. So I'm feeling pretty good. Had a doctor's appointment. Everything came back looking really good. So I'm excited. We're going to keep building up. I just finished the 30-minute workout, doing a cool down now. But hey, I did it. It was really hard. My heart rate was all over the place. It's usually unusual for me. I usually would have it well under control and was building that a lot, but not the case right now. Makes sense with heart surgery and Lyme disease, but I'm getting there. I'm getting there better every day.